Yeah, sorry for the interruption of net. So the first arch now I was telling you is the mandibular nerve. Second arch nerve is the facial nerve. Third arch is the glossopharyngeal. Fourth and sixth arches nerve is vagus nerve. So what happened? The first arch, if you remember, there are only 8 muscles in the first arch. These are 4 muscle of mastication, one anterior belly of digastric, one is the myloid over here, one is the tensor tympani in the middle ear, and one is tensor villi palatini in the soft palate. So one muscle of palate, one muscle of middle ear, one muscle over here, 4 muscle of mastication, one mylohyoid. Even though muscles are at different places, but the nerve supply is the mandibular branch of facial nerve. Sorry, mandibular branch of trigeminal nerve. So this is the region embryologically. Second arch muscles, all the muscle of facial expression, posterior belly of digastric, stylohyoid, platysma. Then you have stapedius muscle. So all muscle of external ear, they are the muscle of second arch. That's why they are supplied by the facial nerve, which is the nerve of second arch. Third arch, there is only one muscle in the third arch. If you remember, I keep on telling you, only and only one muscle in the third arch is stylopharyngeus muscle of the pharynx, and it is supplied by glossopharyngeal nerve. The fourth arch, muscles of fourth and sixth arch supply muscles of the larynx and pharynx through superior laryngeal branch of vagus nerve and recurrent branch of vagus nerve, recurrent laryngeal branch of vagus nerve. So these are the, see, as I told you, all these are the muscles. So these PPT you will get through the map. And if you remember, this is more than enough. No need of even book. So these I told you muscles all. Now skeletal element of each arch. The first arch, okay, first arch give rise to development of mandible. So the first arch give rise to development of the mandible. Second arch, and the first arch, if you see, the stylomandibular ligament is there. That is the remnant of first arch. Second arch, you remember 5S. What are those 5S? The skeletal element of second arch. Stapes is the bone. Styloid process is there. Stylohyoid ligament is there. Superior horn of thyroid cartilage. Okay, hyoid bone. Superior cornu of the hyoid bone and superior part of the hyoid bone. So hyoid bone, superior cornu and superior part, stylohyoid ligament, styloid process and stapes all begin from S. So 5S are skeletal element of second arch. First arch, as I told you, the malleus is there, the incus is there, incus malleus in the middle ear, incus malleus, sphenoid, and mandible. These are the skeletal element of first arch. Then third arch, you have this remaining part, lower part of the hyoid bone. Then fourth and sixth arch, they are cartilages of larynx. Okay, so these are the skeletal element of various arches. So you can see this diagram and you can remember with this diagram. Same skeletal element. As I told you, first arch you have incus, malleus, sphenoid, sphenomandibular ligament. This is the only remnant. Even after the birth, even still in our life, the sphenomandibular ligament is seen. That is the remnant of first arch. Then you have macal cartilage, mandible. All are the skeletal element of first arch. Second arch 5S. Third arch you have this hyoid bone. Fourth arch and sixth arch, this cartilage is of larynx. These are same skeletal element. What I told you, the skeletal elements are there. Now arteries. Each, see, this is the gut. If you remember, this is the gut. Let me try the diagram. If it is there, no diagram. In front of gut, there is a aorta, that is ventral aorta. Behind the gut, there is a aorta, that is dorsal aorta. So front and behind the gut tube, you have got ventral and dorsal aorta. Now ventral and dorsal aorta are communicated like this through aortic arches. They passes through the pharyngeal arches. So aortic arches are there. Aortic arches passes through the pharyngeal arches. Now first arch artery is the maxillary artery. Second artery is the hyoid and stapedial. No need to remember, but you should know the aortic, each pharyngeal arch has got its aortic arches. Now, after this, what is the applied anatomy? or clinical embryology of these arches. Now, due to any anomaly of the arch, they can lead to certain condition. One is the first arch syndrome. What happened due to lack of migration of neural crest cell into the first pharyngeal arch? There is a condition you can see in this diagram. This is known as Treacher-Collins syndrome. Treacher-Collins syndrome. It is a autosomal, okay, chromosomal disorder in which there is malar hypoplasia. Malar means this area, maxilla and all, not properly developed. Mandible is not properly developed. Mandibular hypoplasia is there. Then slanting palpebral fissure. The palpebral fissure, normally we have like this palpebral fissure. This is slanting palpebral fissure will be there, and deformity of the external ear. So this is known as the Treacher-Collins syndrome. This is the anomaly of first arch. This is first arch. First arch Treacher-Collins syndrome. You can see the micronathia. Chin is regressed back. Okay, chin, you can take smaller chin, mouth deformity, ear deformity. These are, you see ear deformity of the ear, the mandible deformity. Other than that, there is a Pierre-Robin syndrome. It's again an anomaly, autosomal disorder. In that micronathia, smaller chin, micronathia is there, and there will be cleft palate. Palate, there is a gap. Palate fusion won't be there. Palate cleft will be there. Then tongue is more posteriorly placed. Glossotosis. Glossotosis is tongue is placed more posteriorly. This is Pierre-Robin syndrome. So now second we are going to see, so I told you first about pharyngeal arches, 5 arches, each arch has got skeletal element, nerve, muscle and artery. Now we will see the pharyngeal cleft outside. Outside there are the pharyngeal cleft, okay, these are the pharyngeal cleft. These depressions are known as pharyngeal cleft. These pharyngeal cleft, the first pharyngeal cleft, okay, that give rise to tubercle, smaller tubercle. Those tubercle are known as auditory tubercle. They give rise to external ear. So first cleft give rise to external ear. From second cleft onward, there hangs a projection downward. That projection downward meets with the last cleft, and a space is formed that is known as cervical sinus, and later on that is obliterated by the tissue and smoothness of neck is formed. So those are the pharyngeal cleft. These are the pharyngeal cleft. So external ear and smoothness of the neck, that is derived from pharyngeal cleft. So this is the first cleft, external auditory meatus. Second, third, fourth, they disappear and give smoothness of the neck. Now we'll see the pharyngeal pouches. What is the fate of pharyngeal pouches? These are the pharyngeal pouches. That can be a separate question. So when you see the first and second pouch, these are the, see the EG diagram I'll show you. So you can remember in that EG diagram, pharyngeal pouches, which you can draw in exam. I'm looking for this. This one is there. This one, see. This is the EG diagram. The first and second pouch, the posterior part of, if you see, first and second pouch, that form the tubotympanic recess. The first and second pouch, posterior part, give tubotympanic recess. That tubotympanic recess give development to middle ear, auditory tube and mastoid antrum. So middle ear, auditory tube and mastoid antrum, they develop from tubotympanic recess. The tubotympanic recess is formed by the first and second pouch. Second pouch also give rise to palatine tonsil. Palatine tonsil develop from the second pouch. This is the palatine tonsil. Now it also give rise to, if you go to third and fourth pouch, they give rise to parathyroid gland. Third and fourth pouch, they give rise to parathyroid gland. So initially what happened, the third and fourth pouch, the superior parathyroid gland and inferior parathyroid gland, they lies at the higher level in the embryonic time. Later on, the thymus also develop from the third pouch. So when the thymus descend, thymus comes downward, the inferior parathyroid gland later on comes downward. So initially the parathyroid gland, inferior lies higher level and superior lies at the lower level. So these are the fate of endodermal pouches. So endodermal pouches, first and second give rise to the middle ear, external auditory canal, mastoid antrum and tonsil. The second also give rise to the tonsil. This is the second give rise to the tonsil. Third give rise to the parathyroid gland and thymus. Fourth give rise to the superior parathyroid gland and ultimobranchial body that give contribution to the thyroid gland. Now we'll see the how thyroid gland develop. If you remember in the tongue, you have foramen cecum in the tongue. So where the two palatoglossal arch meets, where you have V-shaped sulcus that divide the tongue into ventral 2/3 and dorsal 1/3, there is a foramen cecum. In embryonic life, the foramen cecum, from foramen cecum, there appear a diverticulum that runs downward. That is thyroglossal duct. That is thyroglossal duct. So thyroglossal duct runs downward and that become bifid. And that give rise to thyroid gland. So thyroid gland develop from thyroglossal duct. Thyroglossal duct develop from the foramen cecum that become bifid and give rise to thyroid gland. So that is about the endodermal pouches. So this is about brief you need to remember. What is the fate of pharyngeal arches? There are 5 arches, there are 4 pouches, and endodermal cleft is very easy. So if you remember that is there, so I'll send you